Hello again. My name is Dr. Ron Warner. I'm a doctor at Aligned Care Chiropractic in Portage, Michigan, and I'm continuing to answer the questions that we've been given. I've got a couple here today from some of the younger kiddos in our practice. One is, what is chiropractic care and does it hurt? And the other one, similar, that's why I'm answering them together, is what does an alignment feel like? So, both very good questions. And so, what is chiropractic care to start out with? As a chiropractor, I learn how to use the body to heal itself. Now, I don't teach it to do that. We're all born with the ability to do that. As things go along, our body has repair mechanisms that are inherently designed to take care of, fight colds, fight viruses, fight bacteria, and if you're cut, to heal, to stop the bleeding. Within that, I don't teach the body how to do that. What I do is I come alongside the body and I use the spine to remove the interference in the nervous system so that the brain can communicate with the body. And what I mean by that is I always explain it as your body is like a tent and your spine is like a tent pole. So within there, the spine holds up your posture. So we've all been taught, for the most part, that posture is how you sit or stand, which it is. But physically, it's actually so much more. It's actually a representation, a physical representation of how the brain perceives gravity. So, you've got the tent and you've got the tent pole. So as things occur on the outside of the tent sways, and within there, the tent pole moves also. Within the spine, though, we've got a bunch of segments, 24 within the lumbar, thoracic, and neck spine area. And so they individually move within there. And as they move, they actually cause compression left, right, front, back within the tissue around the spine. What travels through the spine is the entire nervous system. The spinal cord travels through there, and nerves come out of the spine. So if there is compression and breakdown within those segments within the spine, it affects the nerves that come out. So that's the communication between the brain and the body. And I actually use the body itself to bring the spine up and open. It gets rid of the compression within the sides of the spine that allows that nerve information to flow. So that's what chiropractic is. It's, we're quite often looked at as bone doctors or spine doctors. But that is just the tool that we use to actually bring the body up to remove the interference. If we think of more of as like joints, so we work with the joints to open them up and reset them, bring them back to a more centered position to allow the information that comes from those joints to flow. So that's kind of chiropractic in a nutshell, to speak. And so does it hurt? I am an upper cervical physician, and so within that, what I do is I work the high neck area, and that's where the whole tent and the tent pole really come into play. So as I work up in this area here, I break resistance, which allows the body to come up and open. And that it's not just in this area here, it's the entire spine, which, as we know now, that the spine holds the posture, so it literally unwraps or untangles the posture to become a more square, a more upright position after the adjustment. So I'm not cracking or snapping anything. So is there pain associated with the alignment? No, there really is not. So I cause the body to right itself, to bring itself up. So is it comfortable? Very comfortable. I've treated all the way down to less than a month old, and all the way up to, I think my oldest patient's been 96. So it's very gentle, but yet very effective. So that is the answer for what is chiropractic care and does it hurt, and what does an alignment feel like. So thank you for listening to this question, and tune back in for the answer to my next question. My name is Dr. Ron Warner, and this has been from Aligned Care Chiropractic in Portage, Michigan. Thank you.